Any one of you?
Yeah. Yeah.
Okay. Thank you. Yeah, that's okay. Thank you. Yeah. Okay. So we're talking about the learning objective 3, where we're talking about how to understand safe practices. So what are safe practices? What is the indicative content? So what are we focusing on in this content here? Is responsibilities. Who has the responsibilities for safety in care? Is it your responsibility, or is it the carer's the family's responsibility? Whose responsibility is it? It is very important to follow policies in the proper way, and whatever agreed ways of learning have been there in place, we need to work according to them. We need to know how to use equipment safely, different equipment, and we need to know according to specialist. So we might not be specialists in everything. We're specialists in our own field, that is okay, but I might not be, I am a first aider because I've got that training, but I might not be a fire safety expert. So I'll have to have that training if I'm going to deal with that a situation like that. Safeguarding practices. So you should be aware of what safeguarding issues are, like abuse, risk factors, responses to abuse, and allegations of abuse. Comments and complaint systems. So those should be, there should be a complete log of these. So you need to know what happened, when it happened, what led to the situation. Why is this important? Anyone? Why do you need to have an inventory or an incident reporting? It's called an incident reporting, actually. Why is it important? Any idea? What is the importance of incident reporting?
Yeah, for proper record keeping for reference purposes.
Yes. So to keep a record of things, and so that these things are not repeated again in future. So you're preventing what risk is. So sometimes the risk might not be evident to you, but these reports or these trends then show you where the risk lies and how to mitigate them. Again, risk assessment. How do you assess risk, and then how do you manage these risks? There's positive risk taking, where the service user is given the choice to take risks. By risks, what do I mean? You ask the a person who is bedridden, you provide them physiotherapy services, and you try and make them mobile again. That is positive risk taking, but it should be in the positive direction. That doesn't mean that it would jeopardize their safety. So that has to be taken care of. The different dilemmas and conflicts between service users, whose duty of care it is, where do these duties lie. All of this has to be discussed. There should be proper policies in place. The importance of security in health and social care setting is very important. So you're preventing access of unauthorized persons to care settings, security in relation to service user belongings, and confidential information. Infection control policies and practices, and restrictive practices, how to avoid them, when this might be acceptable, staff safety, etc. These are all the things that we'll talk about in this session. Now, if I talk about risk, a risk is a situation that involves exposure to danger, and its risk is considered. Risk has a different definition for different people. So let's say there's an electric appliance lying somewhere. Now there is a risk of fire to that appliance. Let's say it's a stove. It's something that can have an inflammable quality to it. That risk is there, but it has not happened. But you will always understand that there is a risk always. So, and that risk, if you would try to reduce that risk as much as possible, that is why you create barriers. That is why you create safety netting. So we'll see a video regarding this. Just a minute, I'll share it with you. So safeguarding and risk, all of these go hand in hand. So I'll just share this video. Please let me know if you can. Yeah, once I start it. So I'll ask you if you can hear. Are you able to see my screen, the video?
Yes, please.
Okay, thank you. So we are talking about adult safeguarding, what it is, why is it important, what does it mean?
We all have the right to be safe and to live a life free from harm. At certain times in our lives, we might need help and support to do this. Safeguarding is how we are protected from harm, but safeguarding is about more than this. It is about promoting our health and well-being, our rights, and it is about being empowered to make decisions for ourselves. Harm can come in many forms, and it affects people differently, but harm always impacts on the rights we are all entitled to enjoy. Some of the rights that we might need help with are the right to be safe, the right to privacy, the right to be treated with dignity and respect, the right to be involved in decisions about our lives, the right to live free from abuse and exploitation, we all have a part to play in protecting ourselves and others from harm. HICWA and the Mental Health Commission are committed to making sure that Irish health and social care services protect the rights of people that use these services and promote their health and well-being.
Okay, that's about it. So yeah, that was a bit about what safeguarding and what rights we have. What does it mean to have these rights, and how do we exercise these rights? And sometimes we don't realize that it's safeguarding has a lot more to do instead of just documentation. So having said that, we'll go further on. We've watched this. So if I try and explain the management of risk in adult social care. So risk management in adult social care it would involve identifying, assessing, and mitigating potential risk factors. So, so once we know what risks there are, we would want to ensure the safety and well-being of service users. So it's not just the service users who are involved, it's the staff and others also involved. So we'll talk about a bit, we'll delve more into what risk management is, what are the components of risk management. We've talked about what risk is, what potential risks are, and how to mitigate them. So the first point is identifying risks. So once you've identified potential hazards, now a hazard, let's say there is, as I said, an inflammable machine, or let's say a stove, a cooking point. That cooking point is a hazard in itself, and it produces a risk of fire. So a hazard is a substance that you can see there. For instance, if our roofs, or if let's say there's a stair, a walking path, which is a hazard, and it has a risk of producing danger or producing falls for those who pass through that walking path. This could, when we have vulnerable people like adults, or we have children, so the extremes of ages are always more vulnerable. So these risks would include something like physical hazards like slips, trips, and falls. You would also have risks related to health, safety, safeguarding, and environmental factors. So what environmental factors do you think we could have when we're talking about these hazards? Anyone? Does anyone have any idea what environmental factors could be involved in risks or hazards?
Okay, I think a wet floor can be the risk of environmental factors.
Yeah, so environment. So your environment, you might think that it's very hot somewhere, or it's somewhere very cool. Some area might be very cool. So these are environmental risk factors that you might not be aware of them. But it's the extremes of ages. As I said, they're more vulnerable. They feel temperature in a different way. So you would have to have experts there to have an idea of what actually the risk is and how would it impact these vulnerable adults. We're talking about adults at the time. So once you identify these risks, these environmental risks, physical risks, mental risks, all of these risks, you then go for risk assessment once the identification is done. So risk assessment, can everyone see my screen? I keep asking this because I'm conscious, maybe sometimes I miss that.
Yes, I
Yes.
can see it.
Yeah, risk assessment. Okay, thank you. So once the risks are identified, they need to be assessed to determine their likelihood and potential impact. This would involve evaluating the severity of risk. How severe is it? If it is there, how severe is it? And the likelihood of it occurring. How many times would it occur? Is it occurring 1 in 10 patients? Is it occurring 1 in 100 patients? So if it's 1 in 100 patients, you might not want to focus all your energy on that. But if it's 1 in 10, then obviously you would want to completely leave everything else and just work on that, mitigating that risk. Risk assessment should be comprehensive, and then you'll involve other people also, and you'll be giving them comprehensive training to deal with those risks. And then once you've assessed that risk, how dangerous is it, how frequent is it, you'll start mitigating. So you'll start mitigating strategies. This would involve implementing control measures in order to reduce the likelihood of risks that occur or might occur. So you might involve safe working practices. You might want to improve staff training and ensure that appropriate equipment and resources are available. Person-centered risk management. So every person is different. As we go through these sessions, we'll always talk about being person-centered, being person-focused. So everything that lies is around that individual. So every individual has a different risk, and it can be managed in a different way. So it makes it specialized for them. They have their individual needs, they have their individual preferences and goals. So you would want to give them risks to try. As I said, a disabled person might want to start walking. You're trying and helping them to walk. It's a positive risk taking. You might want to overlook this part where you would want to document, but please be aware that documentation is very, very important. Sorry. Okay. I don't know. Has anyone received a request again to record this session? I have.
Yeah.
It is recording. Oh, it is recording. Sorry. Yeah, that's okay. I don't know why it says to record. Is it recording on someone else's screen also?
Yeah, it's recording.
Okay, that's fine. That's fine. That was my only concern. Yeah. It helps because these recordings are always there for you to access later on. So yeah, just share screen again. Okay, so you would want to document everything that happens. As I said, any incident that you would want to report, that has to be recorded. This record keeping has to be set in place so that you know what's happening, and it's essential for monitoring and reviewing risks, and you are accountable, or whoever's working with it, they're accountable to these records or to whatever is happening there. Regular review. So whatever you're doing, it has to be reviewed on a regular basis. It has to be given feedback. It has to be monitored on a regular basis. So monitoring would enable you to adjust, make different adjustments. Maybe they're large adjustments, maybe they're very small adjustments, but they need to be there to improve effectiveness. And then multidisciplinary approaches. So risk management and adult social care would involve collaboration between different people. So you have your staff members, you have different agencies that are working there, you have different, you have the service users themselves and their families who are there to support your ultimate goal, which is care and health of the individual themselves or the service user. Now coming towards safeguarding and incident reporting, we talked a little bit about, we saw a safeguarding video. So any concerns with safeguarding, so the service users might be, you will want to make them free of harm or abuse. You would want to have a robust procedure in place for reporting and responding to incidents so that you know a pattern and then this doesn't happen again. So in summary, it's important to have effective risk management in adult social care, which would involve identifying, assessing, mitigating risks in order to ensure the safety and well-being of service users and the staff. You would want a person-centered approach. This is through documentation, regular review, monitoring, collaboration between professionals, and robust safeguarding procedures. Any questions with regards to this bit? So that we move on. No? Yeah, if you have any questions, please let me know. So next we'll analyze safe practices. So what are the safe practices that are there that you may want to have in adult social care? So there's certain policies and procedures that are there in every organization. So wherever you're working as a carer, as a service provider, you would have certain safety and health policies and procedures. If you're abiding by them, it always helps, not only you, but also those who are involved in your care. So staff training and competency is very important. So you might have a lot of staff, you might have hundreds of people working under you. But if they're not properly trained, and if they're not having regular training, and if they don't have the competency, it's of no use. So I might be trained on first aid, but I might not be trained on infection control. So if I want to work for infection control, I would have to have proper training on that. Otherwise, I'm not considered competent. Infection control measures, since COVID came, we became more rigorous, but that has now gone down the line. It has not been very effective now. This is why we see more infections, especially GI infections, gastrointestinal infections coming with speed, obviously, because these infection control measures have not been in regular implementation. So these have to be there always, especially when you're considering vulnerable adults. Medication management, as I said, record keeping is very important. You need to have records, proper records of medical management. So there might be some patient who's suffered from some allergies. So if you don't have a record of them, or if you've not stored the medication, sometimes they have to be stored in a cooler place. Sometimes there may be administration changes. So you might want to administer an oral dose instead of an IV dose. So how would you know that would be possible only through proper medication management and documentation. Documentation is very important. I've said it 3 times. Always remember that. It helps you in reverting any adverse reactions or errors to be made in future, because errors always happen. But if you document them, your chances get very slight there. Risk assessment and management. So you would analyze the process of risk assessment. We've talked about that. And then you would start managing them. There are different people who would be involved in risk management. So you would want to analyze which people would be most important in this process. Safeguarding, again, you would have to see signs of abuse. Think out of the box. There's a person coming with bruises, an old age person coming with bruises, an old age person who's not been taken care of. These are safeguarding issues which have to be there, documented, and you need to have legal requirements and local safeguarding boards. Person-centered care planning. So care has to be planned, and it's best planned when the person is kept at the center. So there might be a person who you are administering a drug to, and they might want the drug early in the morning, or they might want it at some other time. If that is not in the best interest of the patient, you would not do that. If the patient has to take this medication at a certain time, you would want to do that, regardless of the person's wishes. You would have to go against. But wherever this can be possible, that the person's wishes can be, you could work around them, then always do so without any harm. Communication in any process is very important. So you're working as a team, you have service users, you have their families, you have different agencies, you have the organization in itself working. So when you're working and having clear communication, everyone knows what roles they are playing, everyone knows what expectations are there. You would want to encourage a culture of collaboration and mutual support among the team members in order to enhance safety. And then incident reporting is very important, where you report all incidents that have happened and you learn for the future. And last but not the least, emergency preparedness. We might not think there's an emergency occurring, or there might not be any emergency that has occurred in tens of years, but it happens once and it happens bad. So there has to be proper safety netting for this emergency preparedness and proper training of staff, whoever are involved in it. So in summary, you're always going to have safe practices in adult social care, which would involve abiding by your robust policies and procedures. You need to have clear understanding of what the procedures and policies recommend, promoting safe infection control measures, managing risks effectively, and safeguarding vulnerable adults. Always remember, safeguarding is a very big issue. We might not realize it, but it is a very big issue. It's a hidden epidemic, or it's just a tip of the iceberg that we actually see. What's happening, you have to get that chance, and it might be just one chance in a lifetime for them that they might escape that from that situation. So you have to keep your eyes open for that. Again, effective communication and teamwork is very important. Always go for incident reporting. Always report everything that you have in hand. Any questions here?
No.
Yeah. None? Okay, that's fine. So the third part of this lecture is there are always going to be conflicts. There are always going to be problems and dilemmas between individual rights and the duty of care. How would you balance them? So when you're having a person-centered approach, you know that the focus is on the individual. When you prioritize their preferences, their values, and their wishes, this involves them in making decisions and empowers them. So you know that there would not be any conflict because you're giving them their rights. This is also done through clear policies and procedures. So if it's a clear written document that this is how you promote autonomy, this is how you give informed consent. So informed consent is something that the person is informed about it and they give consent according to it. And then they're completely informed. They're completely informed about the risks, about whatever dilemmas could happen. They're always aware of what benefits they could have. So it's a clear policy and procedure. And this is how you share it with them. And this is how to reduce conflicts between people. Again, risk assessment and management. So if everyone knows what risks there are and everyone knows what likelihood there is and everyone knows their roles, this is how you reduce this conflicts and you manage conflicts. And you're always working towards person-centeredness. So every person would have a different risk and would be managed in a different way. Collaboration and consultation. So collaboration with the individual, their family members, advocates, and other relevant stakeholders would help address conflicts or dilemmas. So you'll always have consultation. You'll always have teams working with each other and working towards the best interest of the service user and their families. Open communication is very important. As I said, it should be very clear. It should be very transparent, nothing hidden. So these things are very important when you're wanting to resolve conflicts or wanting to reduce conflicts. Sometimes these conflicts, however, sadly, they're not going to be resolved. So you would want mediation and advocacy. So sometimes mediators or legal advice could also help in case there are conflicts which cannot be resolved on your own. Then comes training and support for staff. We've talked about this. So everyone, whoever's trained, they know that this is what their duties are and this is what they're trained for. And this is to what extent they can go, not beyond that or not below that. So everyone needs to be made aware of their duties and their limits. Legal and ethical considerations are very important. So such as Mental Capacity Act or relevant legislation, because mental health is very important, especially when it comes to vulnerable adults. Human rights principles and professional code of conduct, seeking legal advice or ethical guidance may be necessary in complex situations. So in conclusion, you will have always conflicts or dilemmas between human individual rights and duty of care, but you will want to have a balanced approach which would respect the autonomy and choices of service users while you'll ensure their safety and well-being in their best interest. There should be open communication, mediation, or advocacy if it's needed, collaborative decision-making, staff training, adherence to legal and ethical principles. Conflicts can be addressed effectively while upholding the duty of care. So that's it from my side for the first session. These are your references that you could look at. And that's it. I'll now start sharing my second slide with you, second set of slides. Can everyone see my slides?
Sure.
Yeah, thank you.
Yeah.
Just a minute. Yeah. So just a minute. Yeah. So I'm sharing my slides again. Okay. So the fourth learning objective, the last learning objective actually, is understanding professional practice in adult social care. So what is professional practice? We'll talk about that and how are they involved in adult social care. So, so what the indicative content here will be, it will be what professional bodies are involved in relation to care, adult social care workers, codes of practices in UK, code of conduct for healthcare support workers and adult social care workers in England, importance of compliance. We've talked about this, how important it is within your workplace, importance of working within your role and responsibility, good practice frameworks and theories. We'll talk a bit about them. Partnership working, how important it is to ensure that the work is consistent and it is safe in practices. What are the agencies which could be potentially involved in partnership working? Within the UK, barriers to partnership, there'll always be barriers. What those barriers are, how can team working as a team and supporting each other as a team help towards mitigating those barriers, collaborative and participatory approaches to care, impact of partnership working, establishing professional relationships and difference between professional and personal relationships. We'll talk all about these. Any question, please let me know in between. So now talking about professional practice in adult social care. Just a minute. Yeah. So professional practice, whenever you have adult social care, it encompasses a range of components which are essential for delivering high quality care and support to individuals. Analyzing these components provides insight into diverse skills, knowledge, and behaviors required in the field. So we're going to analyze key components within professional practices. So the first is ethical and legal frameworks. Okay, so what are the ethical legal frameworks? So professional practice in adult care, adult and social care, it's always important because it guides you according to the legal guidelines. This is important for several reasons. So you would want to respect the rights, dignity, and autonomy of service users. You would adhere to confidentiality requirements and complying with relevant legislations. Person-centered approach. We've been talking about what person-centered approach is. Sorry. Let me just share it again. Okay. So person-centered approach is very important when you're talking about, obviously, professional practice in adult social care. This would involve recognizing what the unique needs are of those individuals, their preferences, their aspirations. Each individual is different. You would tailor your care and support according to them, according to their requirements. You would want to actively listen. You would want to have empathy and collaborative decision-making to empower these people and also to promote their well-being. Communication skills is very important. So as I said, having clear communication, but at the same time, some people cannot have a verbal communication with you. So what are the different ways where you non-verbally communicate with them? You would want to know British Sign Language. If you don't know that, you would want to hire people. Sometimes you would want to have another language. People from other languages also exist, and they're very much a part of this of your service. So you would want to have multilingual facilities there. Empathy, clear articulation of information, nothing hidden, nothing translucent. Everything should be black and white, no gray area. Good communication would foster positive relationships, promote understanding, clear understanding, and ensure that the safe users are involved in whatever decision you're making. Yeah. Collaboration and teamwork, we've talked a bit about this. So whatever professional bodies are involved, they must work collaboratively with all the colleagues. So when all colleagues are involved in collaborative work, it always helps. So people know in the multidisciplinary teams who is involved in what is your duties, what your duties are, how would you navigate across different agencies, and your outcome would be always to have a positive achievement with regards to the patient's safety and care. So this would have this would require effective communication, respect for diverse perspectives, and shared decision making. Reflection is very important. Any idea what reflection is? What do I mean by reflection? Or reflective practice? Okay. So if no one's answering, reflection actually is you're critically evaluating your own actions. So something that you've done, you would want to reflect. So if I did something right, doesn't have to be wrong always. I might have done something right. And for instance, I'm teaching you. And after I teach you, after the session is over, I reflect on what went right. There might have been something that's gone right in this session. There were some things wrong, I admit, and I'm sorry for that. But how would I improve? It is only through reflection. So once I have you again in my session, I would reflect. So this reflective practice would help me in trying and mitigating those circumstances from happening again. It would enable practitioners to learn from their successes and challenges, identify risks or areas for development, and enhance the quality of care provided. Reflective practice fosters continuous learning, self-awareness, and professional growth. So always remember, it's very important within your own organization. Yeah, so continuous professional development. So you might want to develop yourself continuously. So if they're professionals, they might want to engage in ongoing learning, training, and development activities. This is to stay abreast, whatever their current trends are happening or changes in legislation which happen regularly. So you would want continuous CPD for every staff member. Professional boundaries and accountability. So this has to be there written so that the service users are free from harm. You need to be accountable for whatever you are doing, for all your actions, and you must adhere to professional codes of conduct and being transparent in whatever decision you are making. Cultural competency and diversity. So you would always have people from diverse populations in adult social care. So the practitioners who are working there must respect cultural difference. So whatever culture we come from, we should not expect the other coming from them, the same culture. And we should respect their diversity. Embracing diverse or diversity promotes inclusivity. So you're including them in their care. It reduces barriers to care and enhances service user satisfaction, which is our ultimate goal. So in conclusion, professional practice in adult social care would encompass a diverse range of components, which would include adherence to ethical and legal frameworks, person-centered approaches, effective communication, collaboration, and teamwork, reflective practice, CPD, maintenance of professional boundaries, and cultural competency. Whenever you analyze these components, it provides a comprehensive understanding of the skills, knowledge, and behaviors that are required for you to deliver highest quality care and keeping it person-centered and supporting the individuals in adult social care settings. Is that clear to everyone? Any clarification that is required? Bola, any questions?
No.
No, okay, okay. I can take any as we go along. Next, we are analyzing the principles and practice of partnership when we're working in person-centered approaches. So obviously, when you have partnerships, there are going to be several stakeholders. One of them is the service user and their families themselves. How would you work upon those principles and practices of partnership working, and how would it provide you holistic, coordinated, and individualized care? Some analysis on this. So shared decision-making is very important. We talked about this journey where the service users and their care and the people who are involved in the care go through. So if the service user is made a part of the continuum of care, this is how you promote an effective care. So when they have informed decision that this is what we are allowed to do, or this is how we go about it. So they're informed about all components of the, and they're aware of what decisions they can make, what are the risks and harms or benefits of those decisions. They then make the best decision. So it's a shared decision, and it's a shared decision with different organizations and different people who are working, or different professionals also. But it is again going to be person-centered. Collaborative care planning. So partnership working entails collaborative care planning, where stakeholders work together to develop holistic care plans, which would address the physical, emotional, social, and spiritual needs of the individual. So that's not only one need, obviously, the several needs, and all of them are taken care of through collaborative care planning. This approach ensures that care plans are tailored to the unique circumstances and preferences of the service user, promoting continuity and coherence in care delivery. Communication and information sharing is very important. It should be clear and timely, whatever communication is shared with all the stakeholders. This would facilitate mutual understanding. It would foster trust and promote transparency in decision-making. So it would enable all parties who are relevant to be well-informed and involved in the care process. Respect, diversity, and inclusion. Again, as I said, partnership, whenever you're working with partners, you would have partners also working in, coming from different backgrounds, different identities. They have to be respected. These diverse populations, even from marginalized and underrepresented groups, they have to be given respect, the due respect that they need. And then team collaboration and coordination is very important when you're working in partnership. So social workers, caregivers, professionals, and support staff should be there working in a coordinated manner, having clear understanding of their, based on their communication, which should be regular to ensure that care delivery is integrated and responsive to evolving needs. Flexibility and adaptability. So you would have to be flexible where the priorities of the service users exist. So when you're flexible enough, you enable care teams to provide tailored support. So sometimes you might want to change the drug dose, or you might want to change the drug, how you're delivering it. But this should be always in the patient's best interest or the service user's best interest. So you can be adaptable to a certain extent, and it always makes it more person-centered. Accountability and evaluation is very important. So you're monitoring and evaluating on a regular manner. You're getting regular feedback from service users. It is very important to create a a conducive environment and provide improved quality of service and effectiveness. Conflict resolution. So sometimes you would want to resolve conflict and mediation not on your own. So sometimes you would want someone else, a third party, to be involved in constructive conflict resolution and mediation. So you would want to have people in place who work upon these. This is to reach mutually satisfactory resolutions while prioritizing the best interests of the service users. So in summary, partnership working is fundamental when you're considering person-centered care in an adult social care setup. Your principles should be there and they should be well grounded in whatever decision you make. You need to respect diversity, team collaboration, flexibility, accountability, conflict resolution. We've talked all about these. Any questions before we move on? No? So then we assess how multi-agencies, so different agencies work together. How are they going to work together in protecting vulnerable individuals? We are going to assess them. So assessing how these agencies work in supporting the protection of vulnerable individuals. So the first point of the assessment is to have an enhanced risk identification and assessment. So sometimes you would have risk identification on your own, but if you have an enhanced risk identification and assessment through proper trained people, through proper safeguarding people who are involved in safeguarding practices. So it has to be collaborative in order to be effective. So you would want to ensure that no aspect is overlooked and appropriate interventions are in place. The second point is coordinating support and intervention. So whenever you have multiple agencies working together, you would want coordinated support, clear communications and interventions that are tailored to specific needs of vulnerable individuals. By bringing together professionals from health, social care, housing, education, and other sectors, multi-agency teams can develop holistic care plans and address complex needs effectively, promoting continuity and coherence of care in care delivery. Early intervention and prevention is very important. So once you've had an assessment of the harms that can be there or the risks that can be there, you would want to intervene, have an early intervention. Why is this important? This is important for prevention purposes. So when you're collaborating, you have multiple people working together. Agencies can identify emerging concerns, provide timely support, and implement preventive measures in order to address underlying issues before they escalate, promote the well-being and resilience of individuals. Information sharing and joint working protocols are very important. When you're working together, as I said, clear collaboration, clear communication is very important for seamless collaboration between the agencies. So you're sharing your databases, you're sharing your protocols, you're sharing whatever the results you have to make informed decisions in order to protect the individuals who are vulnerable. That is your main goal. Specialist expertise. So sometimes you might not have the expertise there. You might not have the resources there. So you're wanting to collaborate with people from different disciplines, having a wide range of skills, knowledge, and resources. So your support would be tailored and your interventions you would want to meet individuals' unique needs. Safeguarding and risk management is very important. Again, whatever you're doing, safeguarding is everyone's duty. It's yours, it's mine, it's everyone's. Collaborative risk management strategies would enable the identification of high-risk situations. Sometimes you're not aware of them. Sometimes you may overlook them. But then when there is expert opinion there, the implementation of protective measures would be there and the monitoring of outcomes would be there to ensure the ongoing safety and well-being of vulnerable individuals. Then comes empowerment and participation. So multi-agency working promotes the empowerment and participation of vulnerable individuals in decision-making and care planning processes. So when you're involving individuals, their families, their loved ones and carers in multi-agency meetings and discussions, you're making the communication two-way, and you're helping them participate. They then know that they are empowered and their voices are heard, their preferences are respected, and their rights are upheld. It fosters a culture of empowerment and self-determination, which is again a positive approach towards care for them. Continuous improvement. So again, you would want regular feedback. You would want to have a reflective practice. Today, if you don't go back with anything else that I've taught you, please go away with this message that reflect whatever practice you're doing, always reflect on it. What went right and what went wrong? How could you improve? How could you make it better? We are never going to achieve the best if we don't reflect on how to be better. Collaborative reviews of cases, feedback mechanisms, and knowledge exchange forums enable professionals to reflect on practice, identify areas for improvement, and enhance their collective capacity to safeguard vulnerable individuals effectively. So when I conclude, we talked about multi-agency working, how they can support themselves, early intervention and prevention, how important it is, how important information sharing is, specialist expertise, if there's there, you can make better judgments on that. How would you assess the impact of multi-agency working, and how would it help best in safeguarding practices, promoting individual well-being, and ensuring that the needs of these vulnerable adults are met effectively? So these are the references. So any questions that you have, I can take them. Otherwise, you can always email them to learnerwork@ukversity.co.uk. So if there are no questions, this Saturday, we will have our last session, which is the assignment discussion. So as it says that assignment discussion, following that, you will have 2 weeks for completion of the units and its delivery. So when I complete the assignment discussion on Saturday, you will have 2 more Saturdays to complete it and submit it. Okay, that's it from my side. Any questions? Bola, any questions?
No, I'm
Richard,
okay.
Solomon. Yeah, I hope everything is clear.
No.
And yeah, you can always email us, or if you have any questions, we can always take them.
Okay.
Is it clear?
Yeah.
Yeah.
Okay. Okay, thank you all for your time.
Okay. Thank you.
I'll end this session now, and we'll meet Saturday again for our assignment discussion.
Okay. Thank you.
Yeah, the
Okay.
presentations will be available. Can anyone, okay, so they'll be there on the cloud setting, that's fine. So thank you all for your time.
Thank you.
Can you stop recording this session? Sorry.